So hello, everyone. My name is Dr. Brianna Busch, and I'm a chiropractor here at Move to Move. We are a rehabilitation clinic, but also a movement studio as well. So we hold a bunch of different mobility and strength training and movement classes. And then we have the clinical side of things. So chiropractic, physiotherapy, massage therapy. We do acupuncture as well. So there's a whole bunch of, and massage. So there's a whole bunch of different clinical aspects, as well as our movement studio and kind of the more athletic aspect to the clinic too. So we're trying to definitely be all encompassing for a patient or for someone looking to progress in their health and kind of start at the basics and the fundamentals and then build into their later stages of exercise and self-care. So as a chiropractor, we do many things, but I have a big passion, I guess, for pregnancy and postpartum care. I do a little bit of infant and toddler care as well, but I definitely have my focus or my drive towards the mom and kind of the process she goes through between prior to pregnancy, getting pregnant, going through pregnancy, and then her postpartum, and kind of guiding a patient along the way, because there's so many different stages of that. And different things that change in a woman's life as they're kind of preparing for pregnancy and going through that whole journey. And often they're doing it multiple times. So some moms will say it gets easier as they go. Some moms will say it gets harder. But I think if a mom understands the different stages and how she can help her body and guide her body and build strength back in her body through the journey of pregnancy, it will make all of her other pregnancies a lot easier too. And then progressing into the later stages of life, I love working with kind of perimenopausal and menopausal women as well. Our bone density starts to drop. We often reduce the amount of activity we're doing, and our strength tends to deplete. And so just really encouraging adults and women as we progressively age to continue going with a lot of the strengthening and the kind of athletics and the support that goes along with that. So that's kind of where I come from. This is new for me. We're doing a webinar today just to kind of invite people to get involved and hoping to build a stronger community in the women's space in and around the Inglewood area, but also in the city of Calgary and the region through here. So I think it's a very important thing and a big focus of mine to be able to stay within my scope of practice and treat people and diagnose people as I'm able to as a chiropractor, but then to have all these resources around me that I can spread the word to say, hey, I think you should get a second opinion on this, or go to your medical doctor for this, or have a midwife for this, or a pelvic physio for this. So it's a great way that we can kind of come together and create a bit more community that way. So I've taken general chiropractic treatment. I went to CMCC, so the Toronto School for Chiropractic, and then I've taken lots of hours of extra courses. I've been certified in the Webster Technique, so we'll go through that a little bit. But then also taken a lot of extra hours of CE credits in the Pregnancy Core Exercise Solutions course by Sarah Duvall. She's a physiotherapist in the USA, and her courses are fantastic. They're 34-hour-long courses. I've taken the first one and I'm working on the second one right now. And it's all about different conditions you see during pregnancy, postpartum, and then a lot of the different pressure management, core bracing, exercise techniques to help a woman through those stages. So even in my non-pregnant patients, it's changed the way I practice for a lot of people, including men, working with hernias, working with pressure management, working with disc-related injuries. So yeah, I just love that it's been all-encompassing and not just specifically for women, but I do have that passion for women's care. So common conditions that I myself as a chiropractor can diagnose and then treat are things like sacroiliac joint dysfunction, pubic symphysis dysfunction. So that especially happens as the baby's growing and the mom's pelvis is expanding and there's that relaxin hormone. Women often get a lot of sacral pain or a lot of front pubic symphysis pain. And technically it's all, the ilium and the pelvis is all connected from front to back through the sacrum. So you can see how they interplay with each other. And then the muscles in and around that area are all pushing and pulling and trying to support everything. And because especially during pregnancy, the hormone relaxin is so prominent and at play, it's a lot harder for women. They get treated and they do really well, but then it only lasts an extra short time because their ligaments are so loose. So it's really important during this stage to build kind of the concept and understanding of how to strengthen and balance the musculature from side to side and also front to back in the pelvis and the core as well. And then working on pressure management. So how to breathe properly, how to make sure that all your pressure is not pushing out through your tummy because it's obviously vulnerable as it's already stretching. How to make sure not all of your pressure is pushing down into your pelvic floor. So we deal with a lot of things like pelvic floor prolapse, incontinence, both urge incontinence and stress incontinence. So urge incontinence is more of a retraining. It's a lot of guidance and understanding and education for the patient because it's not necessarily that something's wrong physically, but it's just we have to change those people's habits. Versus stress incontinence would be more impact or pressure-based incontinence where people don't have the strength or maybe the understanding of how to modulate their pressure in their canister or in their system. So they're getting a lot of force down through the pelvic floor and often can't hold their urine or their bowel movements. So see a lot of that. Diastasis recti or diastasis recti, depending tomato or tomato. But that's where the abdomen starts to separate during pregnancy. And almost everyone gets some to some extent during pregnancy. Some get it quite badly. If we have more than 3 finger widths of separation between the 2 sides of the abdomen, down what we call the linea alba, then it's more of what we call a pathological diastasis. And so we treat people right from when it's very small to when it's big. And we're obviously trying to kind of guide the core and all the muscles to pull into and kind of rejoin the front of the abdomen again to keep it nice and strong and healthy. So again, that has to do with pressure management. If there's too much pressure pushing forward, it's going to cause more separation of the abs. So even though it's a natural thing with pregnancy, there are definitely ways that we can really help even prior to pregnancy, help strengthen a woman's core, get them understanding how to manage their pressure so that when their abdomen is expanding during pregnancy, they're more able to handle that expansion and know how to kind of knit it together and keep it a bit more closed. Which then ultimately we hopefully can help them with the even severe ones, maybe get them to the point where they may not need surgery or other more intense methods that way. That's the hope. Headaches do a lot of that too. Pregnancy, people often don't think of the upper body as much, but there's a lot of neck and upper back tension. The rib cage starts to kind of flare up and out as people get bigger in the front. And so there's a lot of tension, neck and shoulders, hormonal headaches with the changes in the pregnancy hormones too. So we deal a lot with that. In general, low back pain, piriformis syndrome, some sciatica that can happen a lot too. And then even things in the hands. Carpal tunnel syndrome happens a lot with pregnancy because of hormonal change. And also something called D. Quervain's tenosynovitis, which happens in the tendons right along the thumb here. And I see it a lot actually with dads and moms, new parents, because they're lifting their kids all the time and doing this kind of motion with their hands. And they start to get a lot of symptoms down in through the wrists and the hands. So even things that are far separated from the spine, which I guess I was talking to my colleague today, a big portion of this talk that I want to kind of get across is that chiropractors are not just there to treat the spine. I'd say about 40% of our training is in the extremities. And we're not just there to give the adjustment. So even though that's kind of the first thing people think of when they hear of a chiropractor, they think spinal adjustment. There's all these other things that chiropractors, just like with physios and massage therapists, we can kind of learn and train and weave our way into these different pathways. And so I guess just getting that across to people of like what we can do, what we can't do, which we'll go into, and then how we can, use our expertise, but then refer out to the others to help support the mom as well. So we talked a bit about the common conditions diagnosed. Some of the biomechanical deficits that we look at for pregnancy and beyond are the postural correction, some lifting techniques, especially new parents. They are lifting a whole lot more than they ever thought they'd need to. And so we need to make sure that they know how to hip hinge, they know how to control the core, that they're strong in their upper body, they know how to kind of set their rib cage, work on their breathing to help control everything. So we do a lot of that. Breastfeeding techniques, return to regular activities of daily living, but also all these new activities of daily living. So helping moms and dads with like baby carriers, both the front carriers, making sure the baby's hips are in a good position. New sleep positions, oftentimes, especially if they're co-sleeping, a lot of parents don't have enough space to move around. So just helping them find good sleep positions that will protect their spine and their tissues and their body. Proper ways to carry their car seat. A big one I see is making sure people can have enough hip hinge and enough reach and control in their shoulder blades that they can hinge over a crib and pick their baby up and out of the crib. So even movements that seem small, when you've just had a baby and you're feeling not the greatest and your core strength is kaput and you're dealing with scar healing and tissue healing, it can be a lot to lift the toddler or the baby in and out of the crib multiple times a day, especially because you're having to lift up and over something. So that's a big one we work on. And sitting on the floor, especially when you have a toddler, you're on the floor a lot when you have a new baby. I know when I sit on the floor, I get sore after about 10 minutes of sitting on the floor itself. So really teaching someone just using yoga blocks, trying to open up their hips, trying to have them sit up on the front of the sit bones, just to kind of give a bit more engagement and openness through the body so that they're not tilting their pelvis under and causing a lot of that low back strain. So yeah, so different things like that. And then a lot of education and confidence building. I find half my job is encouragement for people. So really making sure that they're feeling comfortable, and I know they're not feeling as strong as they did prior to pregnancy, or they may not be pregnant yet and they're hesitant to go into all of that, or they have some, preconceptions of labor and delivery. So it's just a lot of encouragement, a lot of backing things up with what we do know in the science and the evidence, and letting them know that it's a time in life, but that they will be able to get back to almost 100%, if not 100% of what they were prior. But it is definitely also a long journey. And so when we talk about prognosis for pregnant patients, taking them through this whole journey, I mean, it's about a year, maybe even a year and a half from prior to all 9 months and then postpartum. So it's definitely, if patients are willing to do the homework and do a lot at home, and we're there to kind of guide them and support them along the way, and then refer to these other practitioners too, they're going to get the best care. But it is a lot that they have to, I guess, be motivated to do on their own. So if I can help motivate them, then that's part of my job too. So infant, and we have a question from Leah here. So she said, do you work with patients who are suffering from postpartum hemorrhoids? So yes, we definitely do. A whole aspect is pelvic floor support and control. And I actually recently had a patient dealing with multiple hemorrhoid surgeries that she's had. And a lot of that, both with men and women, is, again, a pressure imbalance in their system. So a lot of times they're putting too much pressure down into their lower abdomen and their pelvic floor. And that causes bulging. And I guess hemorrhoids would be a form of prolapse in a sense. So we also talk about bladder prolapse and pelvic floor prolapse, where your organs actually, well, it sounds horrible, but your organs start to descend and actually push through the orifices of the pelvic floor. And so we really need to work on strengthening that pelvic floor, but also understanding how to relax the pelvic floor so there's not as much tension, and then working on how to use our breathing and our strengthening to even out that pressure so it's not all pushing down. So yeah, we definitely do that. And that brings me to the point of referral out to a pelvic physio, where I, as a chiropractor, we can do coccyx adjustments. So we can actually go through the anus and work on the coccyx or the tailbone. I don't do those, but there are some chiropractors who do that in their practice. But we cannot do internal vaginal exams. So pelvic floor physios, almost always, anyone who wants to get pregnant or is just postpartum, I'm like, go see a pelvic floor physio. There's a list of good ones in the city. And so if any of you are pelvic physios, please email me and send your info, because I'm always looking for ones in and around the city, because they can do internal exams and they can see whether the pelvic floor is tight or weak or tight and weak. And then that I can take and use for my rehab to really help zone in and focus individually for that patient on what they need. Because if I'm telling them to do Kegels every day, not necessarily knowing that their pelvic floor is actually too tight and too taut, then that can actually be detrimental to a patient. So having a pelvic floor physio on board is so necessary for the work I do, to make sure that they can work internally, loosening up the structures, giving the patient education and guidance, and then kind of giving that info to me so I can continue on with the more external work. So I'd say the types of treatment I provide as a chiropractor. So you've heard a lot of education, a lot of exercise-based therapy, also the hands-on work. So I'm a diversified chiropractor, and so is our other chiropractor that works here. So that means that we take technique systems from many different areas and we combine them based on what the patient needs and what we feel comfortable with. So we're not specifically looking at, say, drop piece adjusting or activator adjusting or NUCA technique or a whole bunch of different realms. That way we can take pieces of whatever we've learned, and in our schooling, we were diversified trained, so a broad range of things. So I have a big passion for soft tissue therapy. I do a lot of that with my patients, kind of loosening up the structures, getting them moving, lots of mobilizations of the joints, some manipulations as well. With pregnancy, sometimes mamas are a little bit more hesitant. We use the drop piece with pregnancy. It's excellent, it's safe, it's healthy that way, as long as there's no red flags for the pregnant mom. But sometimes people don't want that little bit of drop, so we just do some more hands-on mobilizing. And then the adjustment tool, or the brand name is an activator. Some people know it by that. So again, getting a manipulation or a force through the joints without being as, I guess, aggressive with it. So not just cracking, but other ways to adjust and mobilize the spine and the extremities, and then a lot of soft tissue work. And then some great people around here to refer to for needling and different things that way too. So I think a big thing with this is making sure everyone understands the treatments that a chiropractor cannot provide, because there are often some misconceptions with this. So one of the treatments is, and the question you always get is, can you turn a breech baby? And no, the answer is no. We are not OBGYNs. Those are the doctors, and not even just a medical doctor, but a specialist that you need to go to help with that. So what does happen though, and I have been Webster trained, and Webster trained in the past. So that is a specific technique system that we can do, checking specifically a joint, a muscle, and a ligament on the back side of the body, and a joint, a muscle, a ligament on the front side of the body, and working on that and opening that up a bit. Sometimes if a baby is breech, utilizing those techniques and different other hands-on techniques, sometimes it will relax the mom's pelvis and relax the area through there enough that a breech baby will naturally turn on its own. So that can happen, but we are not claiming or promoting the fact that we turn breech babies. But if we find something musculoskeletal, which is in our practice, our scope of practice, and we are fixing those things, oftentimes a great byproduct is that the baby will turn on its own. So I have had some moms where they were like a week away from a C-section, and we did some treatment, and like literally a few minutes before, the baby was able to turn on its own and go. And who knows if that was from chiropractic or not, but it's a way to kind of help open up space, relax the area of the pelvic floor and the pelvic region, and hopefully guide in that. But it's also really relieving for the mom. So yes, no turning of breech babies. I actually had a patient the other day. She was a new mom, and she was concerned about her toddler, and she's like, can you diagnose cerebral palsy? And so that's another thing where no, you need you need to be a specialist in an area to diagnose that. So again, that's something I would refer. If we're thinking that there's some motor issues going on with a baby or something that is not kind of lining up with their proper development, then we need to refer out and make sure that they're getting the screening and the testing that they need through their medical doctors, and then potentially specialists from there. Same thing with ADHD or spectrum disorders. Those would require a medical doctor or specific psychologists or counselors that have the training to diagnose that. But I always like to mention that chiropractors are labeled. We're one of, I think, 5 types of doctors or 6 types of doctors in Canada. So we are labeled as primary healthcare practitioners. And so that means that we have the scope of practice, but also the, I guess, we really need to do this is that we see patients and we see them quite frequently compared to, say, your medical doctor. So we need to have the fact that we can assess them, diagnose them, treat them for what we can do in our scope of practice, but then we have that ability to refer out and make sure that the patient is on the right track that way. So as a primary health practitioner, that is one of my biggest things is, if I can't treat you, who can I send you to make sure that you're being taken care of in all the ways possible? So sending you out to more the allopathic route or allopathic medicine route, which would be like medical doctor, specialist, sports specialist, orthopedic surgeon, any sort of other surgeons of that route, but also more the conservative or holistic route of massage therapists, physiotherapists, osteopaths, acupuncturists, naturopaths, midwives, doulas. So there's a whole list of people that we can use and pick from depending on the patient and what they need to help with their journey along the way. So another thing I'll just bring up is in terms of me referring to pelvic physios is that some of them can even work with pessaries. So when Leah was asking the question about hemorrhoids, sometimes people have the bladder prolapse, and there's certain pelvic physios. I know a great one that works out of close to Rocky View, and she helps people with bladder prolapse and inserting the pessaries and helping them that way too to help protect and support their pelvic floor. So that's, again, another option where I would refer to a pelvic physio to help with that. Lactation consultants are huge, making sure that a baby, once they're born, is latching properly. And often I'll have patients come to me after seeing a lactation consultant because they have tightness in their jaw or they have torticollis and they're not rotating from right to left with each breast or not latching properly. And I always check with babies, have they had a check to make sure they don't have a tongue tie? So lactation consultants are great for that as well, or a lip tie too. Nutritionists and dietitians, doulas, and then one that people often don't think about for both the man and the woman is psychologists or counselors. Starting a family and growing a family is a big change for a lot of people, especially if you're new to it. And then there's the aspect of postpartum depression after pregnancy. So really kind of keeping my eyes out for signs of that and making sure people feel comfortable to open up enough with me that I could say, okay, I think this is something that maybe we should explore. And here's an option to see a psychologist or a counselor and someone that could really help give you mental tactics, because they're just as important as a lot of our physical tactics that we work with. So the kind of a couple of things from our clinic specifically at Move to Move. We have a great setup here where I will often, even sometimes right off the bat, as I'm treating a patient with chiropractic, I'll get them to see massage right off the bat or physio right off the bat in-house so that they're getting, number one, a second set of eyes on things. They may see things that I'm not, that can help with the patient's progress. And then also just certain, everyone has different techniques that we've learned over the years. So needling, different things that way, massage, osteopathic massage. But then we also have the ability here of progressing a patient. So I like to think of the initial clinical practitioners, the physios and the chiros and the massage therapists, as kind of the initial outset. But then from there, we do a lot of movement classes and mobility classes. And then we can even progress the patient past that into traditional strength training. So we have a couple of strength trainers that work here too. So I like to think of myself as more the isolation destination for patients, where we're really diving in and focusing on the initial functional things with their body, the deep stuff that maybe no one's ever taught them, really helping them isolate one specific area of their body. And then we can slowly start to spread into that, help them use their body a little more. They can join movement classes and mobility classes. And then they've gotten to the point where it's like, okay, let's progress them to like a full strength training program that way. So passing them off to our strength trainers once they're at that point. And I've seen such good progress with my patients who have been doing strength training while I've been working with them at the more isolated stuff, and they're progressing so well into postpartum and beyond. So yeah, so even strength trainers, and then obviously always alongside their MD, their OB, their midwife, their doula, working that way as well. So last thing I'll talk about, just an initial treatment plan for a patient. So I go through a history. As chiropractors, we have to diagnose something before we can treat it. So we need a good, thorough history, making sure there's no red flags for the pregnancy, looking at past pregnancies, how they went. That gives us a lot of insight. And then kind of patient goals for this pregnancy, what they want. Do a good physical examination. Baby exams, we do a lot of the initial reflexes for the baby, looking for specific issues like plagiocephaly, torticollis, lip ties, tongue ties, all that sort of stuff. So some of the stuff I can quickly screen for. Others, I would want them to see someone else like a physio or a lactation consultant to look into more. But we do a good physical exam. Go through the informed consent, always making sure they're comfortable with what's happening and helping them understand their prognosis, which again, going through pregnancy and getting the body back to where it was is a very long process. So helping people understand that this will not be a day, but it could be weeks to months to years, and just breaking it down for them, but also making sure that they understand that it's a process and that they need to just be patient and work bit by bit, and we can motivate them and support them through that. So we go through their plan of management, how long we're going to do things for, when we're going to do things, what we're going to do things, who else I'd recommend they see, and then we can kind of guide them into that progression. Going through patient goals, practitioner goals, working on the actual treatments, and then coordinating care with the other practitioners. But also as chiropractors, we have the ability to send for ultrasounds as part of AHS and x-rays as a part of AHS. And then also private MRIs too. So a lot of times I'll have a lot of the physios here where we will make sure that patients are getting the imaging they need, because chiropractors can send for a lot of that imaging, which is great. So last, I'm just going to go through an example of a condition that I would kind of walk a patient through in terms of what I would do for this condition and the steps we would take. So if someone had diastasis recti, or kind of that opening of the midline of their abdomen from pregnancy, as I said, it's normal. Almost everyone gets it to some extent. So if we had just a general kind of say non-pathological diastasis, I would start them by going through a history, asking about it, letting them know that the time frame could be months and there will be multiple practitioners involved. So right off the bat, making them understand that. My treatment would include breath and pressure management. It would include core control, getting their thoracic mobility up to par, working on that like high hinge point or rib flaring, kinesiotaping or bracing, and then modifying their activities of daily living. Outside referral sources would be things like massage therapy to work on muscle work and relaxation. So a lot of times we're always talking about strength, but a lot of times we need to teach someone how to relax too. And massage can be wonderful for this, and also for stress management and calming down the nervous system. Pelvic physio, I would send to for an internal exam, as well as internal soft tissue work. And then if there's any internal based exercises that they need to work on, and guidance that way. Strength trainer for progressing the patient as they go through kind of the initial chiro stuff. They're learning how to brace, they're learning how to work with pressure management. Then we can compress or like progress them more to exercises that are more compound and bigger movements that they're going to use in their daily life. And then a psychologist or a counselor, potentially. Women's bodies are changing so drastically, and that can often be hard psychologically for a lot of women. So if you're, if I'm noticing that this person's having a really hard time with the changes that their body's going through and they don't look the way they used to, I like to see it from a functional point of view, but it's really helpful then to have a psychologist or a counselor working with someone to make sure that they know the tactics to help them mentally to kind of get over that hump and loving themselves again. So, and then obviously sometimes you do need a medical doctor referral who can then potentially refer to a specialist for the diastasis patients that have a pathological separation, so more than those 3 fingerlets that may not ever fully close, and functionally they may need someone to go and surgically repair it. So if that's the case, that would be kind of through the MD and through a specialist for surgical consult. So that is, where I wanted to go today. So I guess overall, what we do, what we don't do, who we can refer to, and just helping people understand that there's such a broad scope of practice that we can do for chiropractic as opposed to just the adjusting. So there's another question here. Is chiro safe during the entire pregnancy? And when would you follow up after the birth with both mom and baby? That's a great question. So yes, it is safe during the entire pregnancy, but everyone's history, assessment, treatment will look different. So there are pregnancies that we have big red flags for, that the medical doctor or we know that we should not be doing X, Y, and Z treatment-wise. So we have to be cautious with that. That's why we go through a thorough history. But we can stick within our scope, within what doctors have prescribed for the patient. And as I said, half of what we do is education and understanding the body. So we can at least at the bare minimum help with that. Different treatments. I personally don't like to use the drop piece on patients in their first trimester. It's not that we can't, it's not that it's not deemed safe, but I just know that the first trimester is a little bit more risky and don't want to put myself or the patient at risk that way. So I like to stay away from that and use more gentle techniques during that time. But it is still deemed safe as long as there's no high risk pregnancy. And after birth and pregnancy, usually it's around the 6-week mark where doctors are saying you can kind of slowly get back into things. A lot of times mom will have some tearing that has had to heal up. And so C-sections too. C-sections you take a little bit, often, not always, but often longer to heal from a C-section. So really it's when the mom feels comfortable and confident. We can see a baby as well and a mom day one. Like if they came from the hospital and came over to the clinic, I would still treat them, but it would depend on how I treat them. And obviously, usually I will see moms kind of starting at the 6-week mark and past, but there are still some very gentle things that we can do both exercise-wise and treatment-wise, even before that 6-week mark. So, yeah. And then the last question here talks about C-section and my treatment approach with that. Which brings me to the point of I love teaching patients. So after a C-section, there can be a lot of scarring. And so I've used techniques like this, even for people that have had like laparoscopic surgeries, like gallbladder removal and different things that way too. So working on scar massage. And again, that's something I would also refer to a massage therapist for. Skin rolling techniques to try to like loosen up the tissue, get that tissue moving again, try to break down some of the adhesions of the scar so that the scar heals better. And then huge with C-section is safe lifting. because they often have to go on bed rest for a while. So they're also deconditioning their whole body while they're on bed rest and healing. And then they have to get up and take care of a baby. And so just really making sure that they're understanding how to control their core and their pressure so that they're not further putting tension on the incision. So yeah, so lots of hands-on work, scar tissue work, and then also the education and the exercise therapy for that. So yeah. So if there's any more questions, let me know. This will be recorded today, and we can always send this over to anyone who wishes to have the recording on hand. And I think over time, we'll put maybe pieces of it on our website as well. So check us out. We have a newsletter too at Move to Move that you can sign up for. So we're always posting different talks and doing a whole bunch of different things here. So if you want to be a part of our community that way, you can join. And if you ever have any questions, feel free to email the clinic, and I would be more than happy to respond and get to know you better. So again, even if you're just like, hey, I'm a pelvic physio in the area, please email and let me know, because I always want to make those connections in and around so that we can ultimately make sure that the patient has the care they need. So thank you, everyone. I hope you have a good lunch break.